I got interested in addiction medicine when I myself went to treatment back in 2000 for drugs and alcohol. I was already a physician, family physician, and I was a closet addict and alcoholic. And I was really surprised when I learned about addiction. I thought I was the only one in the world who had this issue until I myself went to treatment. And in treatment, I became fascinated with addiction and its treatment, and subsequently became board certified in addiction medicine. And I thought, you know what? I would love to open what I think is the best way to do treatment.
Just one real quick thing. One of the
Sure.
reasons that we thought that we would fill a need that no one else had was in the relatively well-to-do market of rehab. People who were doctors, lawyers, et cetera, had means to afford something a little better than an institutional setting like Bradford is. Bradford does a good job for what they do, but quite frankly, the one at Madison does take Medicare, Medicaid. They have a lot of street people in there. There's a lot of fights. There's a lot of problems in their population there,
Right.
and they would like to have someplace a little bit more upscale, and so that's what we were trying to provide. We only had 16 beds. So it wasn't like we were coming in with 400 or something like that. Just 16 beds, a really intimate experience for the people who could afford it.
So we purchased this property with our partner and had this guy working with us. And I think back in May or June, before we were planning on opening, we had the property for maybe 2 or 3 months. He said, Nancy, don't you guys need a CON? Well, I had been working with mental health. So I called one of the head people at mental health and asked them, and I was told, no, we did not need a CON. So we found out we needed one when Bradford's lawyers sent a letter to the CON board. So then we had some contact. We called over there at the CON, what's the office?
The State Health Planning and Development Agency.
Yes, they're the ones responsible. And we were told, oh, you can petition to get some beds. There are no beds available. We haven't done a count since 2005.
Well, there's a loophole in the CON law, and the loophole is if you have a contract with mental health as a rehab, then you don't need a CON.
Right.
The CON is automatic. If we had a contract, then we would have to take Medicaid, Medicare, and the things that they require us to, or at least that's what we thought. And we didn't want to have any part of federal funds because of the Stark laws and things like that. There's a lot of liability there. So
yeah,
and we didn't know how to navigate that successfully. So we would just want to stay out of that. So they were correct in that we did not need a CON, but the caveat is if we have a contract with them. So we didn't know that, and I don't think they did that maliciously. I think that's what they were counting on, is that we would have a contract with them. Before you go there, we did attempt to get a CON.
Oh, yes.
We wrote a letter to the SHPTA and told them of the need, that the state was underserved. According to our statistics, using the National Institutes of Health data, using the census population from 2020, I believe it was, using the latest census data, and showing that Alabama, the number of beds in Alabama, according to their published statistics, fell way short. However, they use a formula that, and they will not budge from that formula, which we believe completely underestimates that need. But we had used a different formula, one that the National Institutes of Health used, to show that the existing beds in Alabama, that we had a shortage of beds, which is our anecdotal experience, because there's so many waiting lists, et cetera, to get into rehab in Alabama. So if we have plenty of beds, why are there waiting lists? Right. I mean, you could always claim a surge, but no, this is generally continual waiting lists in order to get into rehab. So the evidence does not, but they would not budge from that formula. So again, they stated, no, we have plenty of beds according to our formula. We haven't updated the census since 2005, but we still have plenty of beds.
It's meant to keep a monopoly going for those people who do have the CON beds. And we were told repeatedly that if we'll go through the process and if we ever do get CON beds, we'll be grateful for it because other people can't compete against us then. And it's like, that is illegal, unconstitutional. That is, and it ties my hands as a professional. So what am I supposed to do? This is what I trained to do, and my hands are tied.